Greetings and welcome. My name is Michael LeChevalier, and I am the Associate Director of the Lumen Christi Institute. Since 2008, a previous economic crisis, we have hosted ongoing conversations between economists, bishops, and scholars, drawing into conversation economics and Catholic social thought onto issues ranging from the human person to the family to environmental degradation. Reflections like these are particularly important during moments of crisis where the common good is threatened by economic equality, racism, and political polarization. And for these reasons, we're grateful for you to be joining and partaking in tonight's event, where we hear from scholars who will help us think a little deeper and wider about the COVID crisis and lessons after the lockdown. If you want to support our work to help bring the Catholic social teaching tradition into dialogue with the university and our broader culture, you can support our work today at www.lumenchristi.org/donate. We engage broadly in the Catholic intellectual tradition, and a series of upcoming events that we are sponsoring or organizing help to show that. Tomorrow, we are co-sponsoring an event presented by the Collegium Institute on Flannery O'Connor, Imagination, Solitude, and the Oddities of Life. Our web lecture series on reason and wisdom in medieval thought ends this week with a lecture by David Albertson on Nicholas of Cusa. And next week, we bring the wisdom of Augustine to bear on questions of catastrophe with an event on Christians in times of catastrophe, bearing into Augustine's City of God. You can find details about all of these events on our website at www.lumenchristi.org. I'm grateful to our co-sponsors tonight who helped extend the reach of our programming: America Media, Credo, the Beatrice Institute, the Collegium Institute's program on the philosophy of finance, the Nova Forum, the St. Benedict Institute, the Institute of Faith and Culture, and the Institute of Human Ecology at the Catholic University of America. Now, in an age where our discourse can be flattened by our political climate or even by important tools like social media, I'm grateful for our distinguished panelists who are able to help us go a little deeper on our economic and social situation, and to help us think about how ethical discourses like Catholic social thought can leaven our conversation. I'm going to introduce our speakers in brief today, since we have so many distinguished scholars, but you can go to our website, the event page for this, for a full bio. Tonight's conversation will be moderated by Joseph Capizzi, who is the Ordinary Professor of Moral Theology at the Catholic University of America, where he is also the Executive Director of the Institute for Human Ecology. Kirk Doran is the Henkel's Family Collegiate Chair and Associate Professor of Economics at the University of Notre Dame. Mary Hirschfeld is Associate Professor of Economics and Theology at Villanova University, and one of the rare scholars out there who holds a PhD in both economics and theology. Father Paul McNelis, a Jesuit priest, holds the Robert Bendheim Chair in Economic and Financial Policy at the Gabelli School of Business at Fordham University. And then finally, Dan Sulmasy is Acting Director of the Kennedy Institute of Ethics and the inaugural Andre Helliger's Professor of Biomedical Ethics at Georgetown University. He also holds a PhD in philosophy and an MD degree. One quick word before I invite our speakers today to unmute themselves. At any time today, you can ask a question by making use of the Q&A feature at the bottom of your screen. If you're joining us by YouTube, you can send an email to info@lumenchristi.org with any of your questions. Otherwise, if you have any technical difficulties joining us today, you can also always join us at the live streaming link that you can see at the top left of your screen. Otherwise, I invite our speakers to unmute themselves and to turn their cameras back on, and I will hand this conversation over to Joe Capizzi. Joe, thank you very much, and thank you to
Michael.
all
Michael, thank you very much. Thanks to everybody who helped put this together tonight. And my gratitude to all of you who have shown up today to listen to this great conversation. We really have some wonderful people and some difficult issues to talk about. I think before we proceed, of course, we should note that, in addition to the fact that COVID has now taken the lives of more than 105,000 Americans, I think we're approaching 110,000 Americans who have died from COVID. Obviously, many of our cities and many of our communities are also dealing with the issues of racial injustice and rioting and protesting associated with that. So to some extent, one crisis, is intervening on top of another. But nonetheless, I think it's important for us to keep our eyes on the ball of COVID. COVID has withdrawn from the attention of much of the news today. It's hard to find people writing articles on COVID or sort of presenting it to us. Nonetheless, it's still out there and it's still spreading through some of our communities, and it still poses a threat to certain particular constituencies, including, of course, the African American community, which is bearing it in a different way than many of us are. But let's begin, panelists, just sort of by taking stock, if we can, of where we are right now. I've been in part of conversations before. Lumen Christi has hosted conversations around COVID, but now we're at least, about a few weeks, maybe in a couple of instances, a couple of months past where we were before. And there does seem to be a sense that aside from other events intervening on COVID, that COVID itself is diminishing either in its virility or in its mortality associated with it. I'm going to throw this question first to Kirk, okay? But I invite you all to sort of to weigh in on it. Are we right to think that we're sort of moving to a new phase of our experience with COVID, that perhaps we're kind of getting on top of it as a nation, just in the United States? Or is that a false impression?
Well, it's a good question. I think that we're moving to a new phase in the sense that we've reached a plateau of certain epidemiological indicators, but we have not reached a new phase in the sense that people are no longer drastically socially distancing in a way that has dramatic effects on the economy, in particular in a way that affects employment and unemployment in a very dramatic way. I don't think we've moved to a new phase from that perspective. And I think that because, as I want to have a chance to talk about soon, because a lot of that social distancing is very voluntary and is not, in fact, a function of government lockdowns, I think we're going to be addressing that aspect of the COVID crisis for some time.
Great. So Kirk, you're saying then that to some extent, Americans either have habituated themselves into social distancing on their own, or maybe even before the government was acting, we were already sensing there was something different here and needed to, protect ourselves by being, careful about how we presented ourselves in public, and that we're still doing this. Is that
absolutely? I mean, we have very good evidence that foot traffic to locations that are very important for employment in the service industries was declining drastically before lockdowns happened. And we also have evidence in countries where lockdowns never occurred of dramatic declines in that type of activity. And this has huge impacts on not just the service sector or the local service sector for retail and especially food and entertainment services, but it has ripple effects throughout the entire economy and is a big part of why we have tens of millions of people unemployed. And I think the end of the lockdowns is unlikely to completely eliminate that. I think it's plausible that the lockdowns may be responsible for, say, half of it, if you look at some of the recent studies that have come out of South Korea. But half of what we're experiencing in terms of economic costs and consequences is still a really, really big number.
Paul, you seemed sort of animated by Kirk's comments. You more or less agree with that take?
I do from another perspective. And then, I guess I'm a Bayesian, but I also, in terms of statistics, but I mean the idea of Frank Knight and the distinction between uncertainty and risk. And prior, when we first started the lockdown, there was massive uncertainty. We simply did not have data, in terms of the testing and then also the isolation and how the disease was affecting people, its mortality rates of those infected, because we didn't know the numbers of people infected. Now, several months later, our medical researchers are getting information, maybe not as much from the US, from not as much testing, but they are getting it from other countries. So that now we're more able to make the risk-return trade-offs because we know the likelihoods of who can get infected and who did not get infected. So I think that the initial reaction whether it's official reaction or individual personal reaction, was a certain panic based on massive uncertainty. But once we are getting more information, we could make more rational risk-return trade-offs about going back to work. But I also agree strongly with all of you that, I mean, one of the things is when we get massive unemployment, what we observed, especially in Europe, but I'm sure we will observe it here in the United States, is this issue of hysteresis. When people are thrown out of work because of a downturn, and then there is recovery, many of those people never go back to work. You know, the idea is that firms recapitalize with labor-saving technologies. I think that's one of the facets that we will discover, that people who have been working in the service industries might find that their places of employment may adopt new mechanisms where either the older workers' skills were obsolete or are just not needed. Workers are not needed, they will be replaced. So I think that's always the danger when you get these massive downturns that last a long time, that this, what is initially seen as temporary unemployment for many people becomes permanent unemployment.
I just want to second what Paul said. That last point is absolutely spot on, and too few people have noticed it. I mean, the economy is not a machine that's organized in some sort of rational way. The economy is almost like a biological organism where there's a bunch of hidden connections that are very hard for people to notice from the top down. Mm-hmm. Those hidden connections, though, that social capital, if you will, where the small business owner knows this is the supplier to go to get this supply, these are the customers that like this kind of good or service. A lot of that social capital has broken down with many months of social distancing and huge breakages in our supply chains. So you put those two things together, it's by no means clear that labor is going to reallocate in some sort of very quick way. We have previous experience in this country of labor taking a very long time, many years, to reallocate after severe downturns that have not been as severe as this one. So I caution everyone who thinks we've necessarily turned a corner on unemployment. We may not have.
Dan, is that a hand?
Yeah, there's also certainly still a great deal of uncertainty about what we're facing. And I think that's, we don't want to oversell what medicine has done. It's amazing what we've learned so far, but we still don't know, for instance, whether the lockdowns and social distancing actually worked or whether this was simply the effects of the virus running its natural course through the population. We don't know that we're going to develop a vaccine. I mean, there are lots of places where we've tried for decades, HIV, malaria, and there are no vaccines. So there's no guarantee we will have a vaccine. The treatment we have, remdesivir, is actually not very effective. It may decrease the duration of illness for a short period by a day or two, but it's not clear. It's certainly not a cure-all. We don't know how temperature affects this virus, whether we're going to have a lull during the summer and then have a recurrence in the fall again as well, and whether that combines with laxity in our social distancing practices so that it comes back again. I mean, there's still a huge amount of uncertainty and uncertainty even about the risk. We don't even actually know the denominator of the number of people who've been infected. So we can't even calculate that. So I just want to caution anybody who thinks that we know a lot, that there's still a lot of uncertainty here.
Great. Mary, please.
Yeah, no, and I just kind of want to echo some of the points that have been made. Our reaction to this pandemic has been completely unprecedented. This idea of just massive shutdown, not just in our country, but around the world, and whether that was government imposed or voluntary. It's, in addition to the uncertainties about the virus itself, I've always been surprised that people think the economy is going to just automatically rebound, because we've just never shut everything down. And there's just, the economy is a thick network of dominoes and connections, and we've broken a bunch of them, and we can't anticipate what those effects are going to be. And this big economic downturn is on top of a political structure, as we're seeing right now, that's already very fragile. So yeah, that's the main point I wanted to make.
Yeah.
Yeah, let me ask a question that maybe sort of broaches both the economic and the medical or health uncertainties. And it was raised or suggested, Mary, by your response right there. There's this sense that people like me, I don't have, I think everybody here has 2 degrees but me, right? You guys are, so that we all either voluntarily or because, we just take the word of people, who tell us what to do, rather radically, unprecedentedly shut ourselves down and accepted a kind of shutdown of things. To what extent would you guys trace that response to something like the deference given to certain kinds of expertise classes in our society, either the expertise class of medicine or of, the medical and health communities, or economics, the political community, because it does seem unprecedented, like you said, Mary, that I mean, I was talking to my mother about this, and I was asking her about the polio epidemics when she was a child, and there was nothing like this. And why don't you begin?
Yeah, I think Mary is absolutely right that this is unprecedented. And to be quite honest, I think that the experts we relied upon, the epidemiologists, people like Tony Fauci, who's a good friend actually, we're doing what epidemiologists do, and generally they're trying to contain a virus within a fairly small population or geographic area. And they had never even, I think, thought about the economic consequences of making this a policy for entire nations or an entire world. I think people just didn't even think that far ahead. And if one thing comes out of this conversation, I'm the only physician among all the economists, is that physicians and public health employees and experts and economists have to talk together about what we've done here so that we can find a better way for the future, because this was a perfect example of unintended consequences. I don't think people thought about what would happen to the economy.
Go, Mary, yeah.
Yeah, no, I think part of that is the rise and the weight we place on expertise has distracted or caused us to miss the fact that you need wisdom. Wisdom is the integration of knowledge. So Dr. Fauci may be the expert on public health, but he doesn't know how to integrate that with what are the effects on the economy, what are the effects on psychology, what are the social effects. So we've elevated a certain kind of technocratic knowledge at the expense of the kind of wisdom of response. But the other thing that's unprecedented is something has shifted in our culture in terms of our fear of viruses and contagion. People have debated early on whether this was the flu or worse than the flu. Probably it's worse than the flu. I think worse than the flu won that debate. But our response has been much more proportionate, as if it had been the plague, which kills 25% of the population, not this. So in living experience, I was alive in 1968, and that flu was a very bad one. Maybe not as bad as COVID, but in shouting distance. And I don't even remember that.
I would actually respectfully disagree with that. I mean, it depends maybe on where you live and what the experience has been, and maybe the experience from, the healthcare professional versus others. Certainly, Washington was not as badly hit as New York City, but I have never, in my 35 years of medical practice, seen one infection affect so many people, bring so many of them into the hospital, to the point that it really strained resources in really significant ways. So I would not, downplay this. This is more lethal, at least for the people who are symptomatic that we know. Symptomatic COVID is more lethal than symptomatic flu. And it is more contagious. The R0, or the speed with which it spreads through the population by contagion, is greater. So this is not, I lived through the HIV epidemic and was working in Greenwich Village at St. Vincent's Hospital, the epicenter of it. The sort of way in which this came in a wave, a large demand it made on healthcare resources, is really, I think, unprecedented, at least in the last 35 years in the United States. That much said, this is not Ebola, right? And maybe we can learn from this so that if Ebola happens to go pandemic, we know how better to respond.
Yeah, no, and if I can just follow up real quick, I think that's a really good point, but in some sense you kind of make my point. We don't have living memory of anything this bad, so it seems horrible to us. In the meantime, our medical systems and our public health systems have gotten so much better that we expect a certain level of performance, so that when we have something like this, we're shocked and horrified. But I think we all agree that the Spanish flu was a worse pandemic, and it was terrible at the time. And I don't want to minimize the human agony that goes with this, or even the overrun medical systems and all of that. But just the response was different because we had a different expectation of what to expect from medical delivery. So with our high expectations comes our idea that this cannot happen, and then our willingness to pay these very high prices to stop it.
So Mary, I think that's a good point about comparisons with the Spanish flu, which can be illustrative both in terms of similarities and differences. I mean, one interesting fact about the Spanish flu is that it killed over 600,000 people, according to the reports that I've read in the United States. And I think if you scaled that up according to the current population of the US, it would be equivalent to killing about 2.4 million people, which I believe is similar to the estimates that we were given at the start of the government lockdowns about what would happen as a basically worst case scenario of what would happen in the United States if we didn't do anything, if there were no social distancing, voluntary or otherwise. Well, that's what happened in the Spanish flu. And actually our economy by comparison did not suffer the same changes, largely because people didn't make the same changes to their behavior. But I think there's probably two reasons for that. One, which we've been mentioning, which is lockdowns and voluntary social distancing due to fear or perhaps sort of socialized behavior. But I think another reason is that we've had an unprecedented, and we haven't brought this up yet, unprecedented government response, both in the United States and in other developed countries in terms of stimulating the economy. And the way in which they're stimulating the economy is been handing out a lot of cash. I mean, if you look at the extra $600 a week of unemployment benefits being given to the unemployed, there are many people who've joked, how am I going to continue making a living after my unemployment runs out? Because then I'll have to go back to a job which will not pay as much as my unemployment. That's almost certainly having an impact. We have good evidence that very, very generous severance packages, for instance, which is a related phenomenon, cause people to delay substantially in finding a new job, even if they're legally required to find one. So we're hitting both sides of the economy in strange ways here, and I think it's creating a very different experience 100 years later.
Can I? I'm going to take us back real quick before we move forward on some of the things that you guys just touched on to the expertise issue. Mary made a distinction between wisdom and expertise, and I think maybe Dan, you were the one who used the language unintended consequences, right? So as we look back on this, were we just vulnerable to allowing expertise to mask itself as wisdom, to be seen as wisdom, and then sort of to follow expertise, even though while it is a good, right, and it's valuable, it is not the same thing as wisdom. Do we expose ourselves to unintended consequences? Is that going to be a lesson of this experience of COVID and the way we responded to it? Is everybody confident about that? Paul, do you want to weigh in on that since you were quiet in the last round?
I guess, yeah, I mean, certainly, I just wanted to mention, I mean, relating to what you just said about these checks being given, this actually is, I guess, because, and I guess because, Lumen Christi is located at the University of Chicago, a really classic University of Chicago monetary expansion. Although people are talking about the public debt, the transfers to the people were financed by debt, but that debt was bought by the Federal Reserve System. And so it's monetized. And similarly, the massive debts of European countries were bought by the European Central Bank. So there is a massive growth of liquidity in the world financial system. Now, unlike the last crisis in 2008, where the bailout was to banks and non-banks financial intermediaries, most of this has been transfers to households, unemployed heads of households, members of households, as well as to small businesses. So I guess one of the other consequences that, I mean, certainly Chicago alumni friends like Jerry Dwyer of Clemson, James Lothian, my colleague at Fordham, Gabriel Fagan, a former ECB official now at Goethe University, is that we're looking at almost like a controlled experiment of massive monetary expansion with inflation coming down the road. Now, not now, But, when people go back at post-crisis, post-COVID, I mean, they have a lot of money to spend, and that's a class. I mean, this is actually almost a classic monetarist experiment.
So, Paul, I want to let everybody get to the wisdom question, which is probably more
okay.
interesting. And I know we don't have too much economics, but one thing I would say is that what I'm less concerned about unconditional cash transfers than I am concerned about conditional cash transfers that are conditional on not finding employment.
Yeah, so let's go back to the wisdom thing real quick. Here's my fear, okay, right? Is that we were ready to listen to the expert class, and Tony Fauci, et cetera, convinced us, or we were already doing it, Kirk, to your point. Stay home, stay distant, don't mingle, et cetera. And now many of us, we can't even sort out among ourselves. Is this the flu? Is it the bubonic plague? Right? The CDC says the fatality rate, is whatever, right? Is lower than we anticipated. I can't sort through this stuff. I'm not going to listen to anybody, right? At this, right? Why am I going to listen to anybody next time they tell me, lockdown, here comes this nasty thing? Forget it. I'm gonna trust my intuition at this point, because you guys passed off expertise as wisdom, and it turned out there was nothing wise about bankrupting our economy for the sake of something that, if you see it like the way Mary presented it, is a really bad flu, right? Right. It's, again, whether that's accurate is another thing, but I can't tell if it's accurate is the relevant point.
Mm-hmm. Yes, some of what you're saying in terms of the possible public attitude about this happens actually in the clinical encounter too, right? There are patients who will say,
sure,
the doctors told me I was going to die and I didn't die, so now I'm no longer going to listen to doctors at all. So we're used to this.
Right.
But the patient now is the entire population for public health. It's not just an individual, and so the consequences are magnified for lots of folks. Yeah, I think there's a combination, getting back to some of what Mary was saying before about the extreme risk aversiveness of our society in general, and this sort of faith in technocracy to save us from this, that puts us in a whipsaw between our fears, which may be out of proportion, and then our turning to the expertise to get us out of it, when in fact there probably is some kind of wise middle way that maybe we can learn from this pandemic. I don't know that we needed to do a total lockdown. Maybe all the lockdown did was make people wash their hands more, or something like that. That we can find what suffices to bring the level of infections down to the point that they can be handled by the healthcare system without wrecking the economy. And again, I don't think there's any one person who has all that information. And we need to talk to each other and try to work it out so that we learn from this for the next time.
So I just wanted to follow up briefly on what you said, Joseph and Dan, that I actually have been very impressed by the early estimates of epidemiologists about various parameters related to its lethality and how infectious it is. Those early estimates had big ranges. And as we've gotten more data, in fact, the better estimates we have now are very much within the ranges that I was reading about 2-3 months ago. So I don't think that they failed in that sense. I think that maybe a point that Dan raised earlier is perhaps the most relevant point. In order to attain wise policy, we kind of all need to talk to each other. And there's just been too much segmentation. There, you read on the internet, people saying, do we listen to epidemiologists or economists? To which I want to answer, yes.
Yes.
Well, we should be talking to each other more.
Right, and this is a great place then, this notion of like integrating knowledge and so on to sort of direct our conversation towards the common good, perhaps, and our conception of health, right? So far we have also lapsed into the bias of thinking of health in terms of certain medical or epidemiological categories. And I ask all of you, and maybe Mary first, is that an inadequate conception of health? And to what extent do we need to really expand our understanding of health, and maybe Catholic, this is exactly the kind of place where Catholic social teaching can contribute to a conversation in our culture that looks at health more broadly than simply in terms of, will my body survive, this or that condition and so on. Mary, please.
Yeah, no, I think this is definitely something that Catholic social thought needs to bring into the public conversation more, and actually needs to develop more. So Catholic social thought talks a lot about the common good and how to have concern for the poor, and it has a variety of principles like that. But what we really need is a thicker conception of what that good is, what that common good is. In our modern society, it's a liberal society. We don't have consensus about what goods we should pursue. And so we've tended to emphasize what I call instrumental goods, wealth on the one hand and health on the other. And that's how the debate's been framed, right? Either you want to kill grandma or you want to destroy the economy and leave millions of people unemployed, and people fight and they polarize. But we don't ask, what is the wealth for? And we don't ask, what's the human aspect of our wealth getting activities? So we don't think in terms of the impact it has on workers who lose their jobs, or what does it mean to be a productive human being in terms of the quality of your own life as a person. And on the health side, it's just a very thin idea about health. We've cut off a lot of the things that make life worth living. Social interaction is incredibly important for human flourishing. I'm one of the 34 million Americans who live alone, so I've sheltered alone. And it's just been devastating, right? And I can think about the children who haven't been able to go out and play, the social and psychological development that's missing out because they've been cut off through these months. I just think we need a much thicker conception about what the good of life is. And the last thing I'm going to say, my heart has been completely broken. In order to protect the vulnerable, who tend to be mostly the elderly, we've isolated them when loneliness is a key problem in old age. And especially in the first wave, and I understand we were in the first wave when we were panicking, we were taking people at the end of their lives who were dying, very old people who were at the end of their lives dying, and intubating them and having them die alone without being able to have family around. Funerals have not been allowed to take place. There's just a huge tragedy about the thickness of life that's been sacrificed in the name of trying to save lives.
Anybody else want on that?
Well, I would just say that these are genuinely difficult questions. I mean, the trade-offs, if you want to phrase it that way here, are really painful and difficult. So young people who want to have a chance to interact socially, actually have the career they were trained for without suffering the consequences that we know happen to people who start their careers in bad recessions, who want to have a chance to date and eventually get married and have a family. All of those people have been heavily affected by massive social distancing. But on the other hand, if the counterfactual is a couple million people dying, that's also a big cost. And I think we all agree that that's a big cost. And I hope that we're not letting the audience think that we don't agree with that. And so these are very difficult things. It's very difficult to measure just what we should do here. I think, how should I put it? I don't think that there's a technocratic answer to these questions. I don't think there is. I think they're incommensurable goods. The good of living an extra few years versus the good of living one more year really, really well. I don't know how to measure that.
Yeah, I think there are lots of competing conceptions of the common good that you see out in discourse about COVID. COVID almost becomes a Rorschach test for people's sort of views to be expressed. And for many people there, and the economists will be familiar with this, it's really a utilitarian kind of view of the common good. It's the sum of the individual goods. And you see people, ethicists, for instance, trying to ration ventilators and saying, well, we should do it according to life years, and we should not ventilate people who are mentally retarded because of their low social productivity, et cetera. Those voices have been out there. There's a kind of neoliberal view of the common good as being only the things that we have in common, and many air and water and things like that, and everything else is just an individual good, and that's all there is. And those are some of the people you see writing op-eds that sort of say, "Let it rip." I'm healthy, I'll take care of myself, and let go that way. You've got totalitarian views of the common good, where it's the state that controls everything, and you saw that played out in China, right? So they control the virus, but it's at great cost to human freedom to do that. But I think all of us here, I suspect, have a more Catholic sensibility about what the common good is in a way that I would call integral, in which the good of the individual is in part constituted by the good of the whole. And that the flourishing of the whole is part of my flourishing, and also the whole recognizes my individuality and rights and need to flourish. That conception of the common good is difficult to communicate in a world that wants simple answers. But I think the wisdom is in that sort of more integral sense of the common good that may give us a way forward.
Well, but so just following up then, and on that point, and perhaps to push, Kirk, and maybe you as well, Dan, is it fair to say that while obviously these are difficult questions, right? But even the way, Kirk, you began to respond to Mary was by sort of suggesting a kind of, again, health-wealth dichotomy, right? Rather than saying, or maybe asking ourselves, to what extent did we actually consider the deprivations that Mary alluded to? For instance, just the deprivations that would be borne by those who live alone or by the elderly. To what extent were they factored into this decision about how to respond to the disease? Or should they be, right? I mean, it's possible they shouldn't be at all. I mean, I think as Catholics, we, going back to Dan's point and Mary's, a thicker conception of the common good, or of what health consists in, what the flourishing of the human being consists in, would suggest these things need to be factored in, right? And they need to be named, not merely sort of just assume that they're part of, what it means to live another year, right?
Right.
Yeah, please, Kirk, I kind of directed that at you.
What we need to do is we need to move beyond a notion of a health-wealth dichotomy in the first place. Because health and wealth are intimately related in numerous feedback loops. And we can't really view our response to this as some sort of optimization of a static dichotomy between health and wealth. Really what we're trying to do is we're trying to understand a very subtle set of responses that are rippling through our economy, rippling through people's emotional lives, rippling through everything. And they're all affecting each other at the same time. And that's what makes this super complicated. If it was simple trade-offs between health and wealth, it would be easier, but we don't have simple trade-offs between health and wealth. The other thing that makes this complicated, and we need to move beyond, is this notion that, well, we're going to save, however many trillions of dollars by doing a lockdown versus some unnamed counterfactual, which is usually doing nothing at all. Mm-hmm. That's easy. If the response is, look, we can either do literally nothing, like just bone stupid activities, all of us are boneheaded, and that's one option. And the other option is a complete social distancing. Nobody gets together in groups bigger than 2 people. You stay in your household, UK style lockdown. If those are the two dichotomies, then if those are the two options, then it simplifies the world beneath the actual complication that's there. And in reality, there's many, many other things and many gradations that we could do. We could change which portions of the population are being locked down or experiencing social distancing. We could expand testing in ways that China has demonstrated can be done. They just tested in a period of a few days, 11 million people in one region. There's a lot of other options other than those two. And so that's the 2 points I think we need to address. First of all, there's no dichotomy between health and wealth. And second of all, this stupid internet argument that we're not having, but other people have had on the internet between health on one side and the economy on the other doesn't make any sense.
Does the common good do work then? Let me put it like sort of bluntly. Imagine I'm Donald Trump. You guys are my committee. Dan is Dr. Fauci. You're Munchen, I guess. Mary, you get to be Dr. Birx. And I guess that makes Paul Pence. Would we have counseled something different based on a kind of integrated conception of the human being and human and what health consists in and so on? Or would we have more or less, because of uncertainty and so on, been in the same place? Dan, you look like you wanted to respond.
Yeah, I think it's, it's so
Too hard
hard
to tell?
it's so hard to say through the retrospectoscope. I think that people were expecting things to be worse than they turned out to be. In New York, it came pretty close to being what people thought might happen, and the rest. If New York had happened in the entire country, we'd be in really difficult shape. So the response evolved, right, over a rapid period of time. I mean, even Fauci's wife was at a conference with me in early March, and we weren't wearing masks, and we were just elbow bumping. This is, so I think it's really hard to blame people previously. I think what we have to do is say what we know now, what we should be doing now on the basis of the better information that Paul was talking about before that we have now, and what we can learn from this for the future.
Great.
Yeah.
So another aspect of the common good, of course, opens us outside the United States and the experiences outside the United States, and then of course within the United States as well. So there are two issues here. One is something I think, Dan, you alluded to before when you talked about how differently this is bearing on based on where you live, right? And that's just the intra-US issue, right? That certain populations of the United States are bearing the burdens of this, merely the illness on the one hand, and then of course the economic effects on the other, right? Very differently than our others. So perhaps, Dan, you could speak to or begin a conversation about that. And then the second would be the global aspect of this, right? This is a global pandemic. It's implicating virtually every country. It implicates foreign policy, et cetera. And are there, maybe that one question is, are there lessons to be learned on what we've seen in other countries and how they responded? So maybe we'll just start there first to sort of, Dan, if you don't mind, the intra-US, the conception of the common good that might inform the way we think about how COVID is sort of expressed itself in our country, and then the global kinds of concerns. So Dan, thank you.
Well, I think you're right to point out that there's no one size fits all approach, and the people who are asking for that from the president, I think and from the federal government in general, we're simply wrong. I mean, the way this affects Montana is not the same as the way it affects New York City, population density, maybe even the subtypes of the virus that are circulating in different areas need different responses. And so the principle of subsidiarity, for instance, may make some sense in its applicability here, that there are local solutions to this depending on the way the virus is playing out in different places. Similarly, I think we can anticipate your next question with the world. The countries will differ dramatically, and epidemiologists and ethicists in South Africa, for instance, are saying we don't have the healthcare infrastructure to take care of all these people, and it is better to let the virus rip through the population and develop herd immunity, and that may be better for a country that doesn't have the kind of healthcare infrastructure we have. So I think we err if we think that the solution to this is going to be one size fits all.
Great, thank you. Anybody else on
I have a couple things. I just want to follow up on the subsidiarity question, because part of our impulse towards this expertise or so on is to place a lot of weight on these national public health organizations and also the World Health Organization. I've been following this pandemic since early January, and the World Health Organization was very slow to name it a pandemic. And part of the reason they were so slow to do so is because they thought we should all follow China's model, and with the testing and tracking and all the rest at the beginning. And so they kind of had this one size fits all attitude without, it seemed to me at the time, of recognizing that not all countries could do what China did or what South Korea did, because we all have different state capabilities. We all have different civil, what the population can tolerate, different cultural practices and so on. And even locally, like if we devolve to the extent that we've devolved coming down to the other level within states, like my governor, Wolf, shut down the whole state really quite abruptly because we had a big problem in Philadelphia. but that had a very different or bad impact on people in these small counties up in Northwest Pennsylvania. So subsidiarity is just this great principle that says there's something that you can be more responsive to local circumstances the more you're willing to devolve things. But the other thing that, if we're talking about the global consequence, one of the things that's hard about common good is we all kind of do our own thing, and then there's these unintended consequences, and we don't think about it. We, in this country, we've almost entirely had the debate in terms of the trade-offs within this country, without thinking about the downstream impact that our choices are going to have on other countries. The slowdown in the global economy that's coming is going to have devastating impact on the poor around the world. And I don't think we've given enough attention to that fallout.
Yeah, that's a great point, Mary. Subsidiarity is a great principle, right? Because as I always remind my students, it reminds you to look down, but it also reminds you to look up, right? And I think that's what both you and Dan are saying, is there is a sort of, right, the downward effect on the local communities, but there's also the upward kinds of issues and effects on the global. Even the one you just touched on, the burden that this is going to place on global poverty are going to be enormous, clearly, but they're also going to be placed on the poor in the United States as well, right? So, I mean, this is related to, in some ways, perhaps the protests we're seeing in the streets right now, that there are certain communities that are bearing the burden of this disease very differently than mine, or most of ours, right? Most of us, it's DoorDash and movie streaming, and, et cetera, to occupy our times. And meanwhile, truckers are still trucking, and and people are still cooking and, working in, the meat factories and so on. We've all read this. You guys are the economists. I'm not. There are going to be economic winners during COVID, and then there are going to be economic losers. And some of the winners are obvious. They're the big, right, e-based companies, and then some of the losers are obvious. They're the smaller businesses and so on. How does that, or should that also be informing decisions? Should we have anticipated some of these? We keep calling them unintended consequences. I just worry that kind of gets us off the hook a little bit quickly. Couldn't they have been anticipated to some extent if we were thinking through, at least some of us were thinking through, the way the common good is understood in Catholic thought? Paul, do you want in on the?
I take your point, but I mean, I think it just came so fast and so unexpected that it was really hard to think through these. So I don't think I want to be too critical of policymakers, any of them. And there's different responses around the world. But Jesus Fernandez Villaverde also addressed this question. He took it in terms of an intergenerational inequity, that to preserve the people over 60, the under 40 generation bore the burden strongly in terms of unemployment, and especially for the less educated people under 40, who could not stay home and live stream, who worked in stores. It's been a very, very harsh experience. And I guess one of the things, and I guess addressing this issue, I keep thinking of the analogy of post-World War II. You had the young generation in Korean War fought the war while the elders stayed at home. But afterwards, there was some forward thinking, to give these people benefits afterwards. Like there was the GI Bill of Rights, and then massive construction projects, the state highways, interstate highway system, St. Lawrence Seaway, but different ways to get the people who bore the burden of the war, had these new benefits. They didn't go back, to move forward with their lives. And maybe this is what we have to think, that the people who have been bearing the cost of COVID, the under 40 generation who've been hit very hard, should be given some very special benefits. Now, again, how is that going to be done? The other issue, I guess I was in contact with Jesus about this. I mean, I guess the over 60 generation represents in the United States about almost 24% of the population, but their voter turnout is 80%, extremely high. So in terms of, readdressing, redistributing towards the under 40 generation from the older generation is always going to be politically difficult. But I think that's where we should face this addressing this, the inevitable inequities, that the winners should try to compensate the losers from this pandemic, because the losers, bore the price to keep them alive, I think partly. So,
Yeah,
so
great.
One good story to illustrate, I think, the ways in which Kirk's point about the connection between health and wealth and to make it in a global context is one I was told about what happened to the Mayan population. Many Mayans work for the resort areas in Cozumel, right? And an Italian cruise ship came in full of people who were infected the workers who were in the town. Then, because of the COVID pandemic, the ships stopped coming. So all the workers were laid off. They went home to their Mayan villages and infected the villages dramatically. Right? So you can't script that ahead of time and sort of think that's what's going to happen. But these connections are profound and subtle and global, and no one could have anticipated that. But we need to learn from that for facing the future of this crisis and other crises in the future.
Yep. Anybody else on these issues of sort of like the global or the more local common good?
I would just point out that
yeah.
we're used to thinking about questions of the common good and many questions in Catholic social teaching in light of what should authority figures with coercive power in government be doing.
Right.
And I just to reiterate how I was hoping to reframe things a bit at the start of the conversation, we by now have very good economic evidence that at least half of these costs and consequences are related to individuals. Not that we shouldn't be talking about lockdowns. I mean, 45% of the costs are due to lockdowns. We should still be talking about lockdowns. But we need to think about an interesting question, which I haven't heard many experts in Catholic social thought address, at least I haven't personally, which is, what does Catholic social thought have to say about social movements in the age of the internet, about a viral desire, if you will, to be part of the team that protects the old by not engaging in many economic activities that would otherwise be very beneficial to the economy. What does Catholic social teaching have to say about that? I don't know.
Great, Mary.
No, I think culture is a missing level of analysis in a lot of our thinking about this, working through these social movements and these social perspectives. But we did have this strong sense of solidarity that played out in the social distancing. A lot of people were doing it not because they were personally afraid, but because they cared about other people. It was really very moving to see them do that. But we could have extended that vision to also bear in mind that the social distancing was having these other consequences, right? So I don't know if people were thinking enough about the businesses they were no longer, offering their custom to, right? Or thinking about the downstream effects on the rest of the world. And I just wonder if the culture could have arrived at a better balance if we had been thinking about our solidarity on all these dimensions. But I think part of what happened is it's easy to think about one virus and lockdown prevent the spread. It's a lot harder to think, oh, wait a minute, my pet sitter who just lost all my business because I'm not traveling anymore is probably not getting any business. What do I do about that, right? And
also the polarization of our culture, Mary, is perhaps responsible for the dysfunction in which some people thought it was their job to only think about some costs and consequences, and other people thought it was their job to only think about other costs and consequences. But very few people thought it was their job to think about both. So that's the problem.
And Mary, I was very moved by your talking about the lonely deaths of the elderly, and it struck me that one of the reasons that the virus has spread and killed so many people in the United States is the way we do already treat our elderly. Not only are they lonely, but they're lonely together, isolated together in nursing homes, which is the exactly perfect place for the virus to spread. And so the way we treat the elderly at our baseline within the culture has had an enormous impact on the way the virus has differentially affected the elderly.
Great stuff. Yeah, I'm sorry, Mary, go on, please. No.
One can only hope that going forward, we'll think a lot harder about that last stage of life and how to make it good for people. So.
Yes, it's nice to sort of sum up things with a little hope, right? Let's turn a little bit to some of the questions. We've got a great audience, and I see there's tons of questions already. So if you've got a question you want to ask it, please don't hesitate to type it into the Q&A box if you're here with us on Zoom, or to email Michael, as he advised at the beginning, if you're watching on the YouTube. So all of us, I believe, work at universities. One of our questions asks a great question. Would it be wise? Is it going to be wise for universities or colleges to be opening up this fall? So I guess put your hat on, you're John Jenkins, or, whomever else, right? You're John Garvey in my case. What do you think? Do you open for the fall? And by that, let's assume we mean on-campus students in the classrooms in some way being educated by faculty.
I just want to say that I 100% agree with the strategy that Father Jenkins has applied at Notre Dame. I thought it was bold. I thought it was creative. And basically, I would say that his answer to your question was, yeah, we will reopen, and we will open with people, as many people as are willing to come here together. But we're going to change the way we do some things on campus to mitigate infection concerns. And there are many reasons why I think that's the right solution, but I think one of them, which hasn't been spoken about enough, is that truly, maybe Dan will agree with me or disagree with me, but truly, I think the risk to 19-year-olds is truly too low to say that there's no way we can open up a college campus full of 19-year-olds. And so.
Yeah. From an epidemiologic point of view, the risk really isn't to the 19-year-olds. It's to the people who are the professors who are teaching them. It's to the people who are serving them in the cafeteria. It's to the people they visit when they come back home for fall break, whatever. So I think
you got rid of fall break.
Yeah, right.
You did.
Yeah. Well, that's good. I do think that I would like to wait and see what happens over the summer before I would make a final judgment on this, because again, I don't think have enough information yet about whether every place will come down to a low enough level that we can find ways to open up places like universities again in a way that will be safe for the general population. I agree with you. The risk to individual students is not so great, but the risk of them spreading it to other people is what's most significant.
Well, that's why we change what we do, though, Dan. We're changing every single thing we're doing at Notre Dame to address those very concerns. They're exactly the concerns that we have here at the university, and I agree with you 100%. But we're not going to do business as usual when we open up in the fall. If and when we open up, we're going to change, and we already are changing everything we do to help protect exactly the populations you worry about.
And the one feature of the Notre Dame plan that I think needs to be called out is they're starting early, so there will be no fall break, there will be no thing, and so they're going to wrap up at Thanksgiving. So there shouldn't be this back and forth between the student population and at home. And then it seems to me the problem of how do you protect vulnerable faculty or staff is an easier one to handle than the fear of sending a bunch of sick kids back home.
Dan, can I ask a quick follow-up question to you? Just, I think maybe we move too fast over sort of a technical, like, what did we learn question. Mm-hmm. Are we more confident that when people get this, like, so the vulnerable person serving food to the students or the professor or so on, are we more confident about our capacity to treat these people now, or still is it really just, we just don't know?
Yeah, there's still no effective treatment. I mean, there is a minimally effective treatment, remdesivir, and some hope for vaccines, but certainly no guarantees. And even when, I should say, even when young people get this disease, it's no picnic. In Georgetown University Hospital, 5 of our house officers, interns, and residents on the front line using the protective gear, got sick. Fortunately, none of them, had to be hospitalized, but it was worse than the flu, worse than the swine flu that, is part of my experience as well. This is not an easy disease, even for many young people. Not, there are, again, we don't know how many people are asymptomatic and infected, and there may be a large number. We don't know why some people are more symptomatic than others, and we don't fully understand why it is that that some people actually are so overwhelmed by the disease and ultimately succumb to it. It probably is more of an overreaction of the immune system to the infection than it is the number of viral particles replicating in their bodies as a factor in itself. So there's still a lot we don't
So
know.
I want to press Daniel a little bit just about the lot that we don't know. What is your take, Dan, on just how creative we can be if we're a college and we're interested in reopening? Because there's too many reasons why it might make sense to do so, and to at least to want to do so. What's your take on how creative we could be? You're a little cautious in responding to me there, which I respect. But can we afford to not try to be creative and bold coming up with solutions? We spent the first 20 minutes talking about how we're destroying the livelihoods of tens of millions of people. And it's going to take maybe 10 years to get some of those people back into the labor force, during which they're going to become addicted to drugs and all the things that happen to people who have long-term unemployment. And we know it happens. Can we really afford to just say, let's not open up higher education because even creative solutions are still going to infect the 65-year-old professor? Or can we say, hey, let's come up with something creative that will protect the 65-year-old professor, but allow the 40-year-old professor to still teach, and the 27-year-old professor to still hang out with the students sometimes, and the students to be together on campus? I mean, what's your take?
Yeah, don't misunderstand me by raising the questions about caution about opening a saying that I don't think we can. I don't know that the conditions are going to, what the conditions will be by August or September.
I agree with that.
And so even what Notre Dame is doing, I hope, is provisional, that it may be that it needs to be changed if the situation around changes dramatically. Yes, I think that we need to try to find creative solutions and continue to learn as much as we can, and maybe experiment a little bit. Notre Dame doing something, maybe somebody else doing something else, so that we can learn a bit more. And maybe some other universities going totally, staying totally online. I don't think we can stay in total lockdown. It's crazy to think that we could do it for forever. Again, the paradigm that the epidemiologists were using is a very different one. It's sort of, it's a short-term, localized problem with a small population, and you just can't generalize that to the entire world. So I'm with you that we need to try to find creative solutions. I just don't know that we know enough right now to say exactly what those creative solutions are, nor do we have a good enough sense of what the late summer is going to look like to say that even the experiments that Notre Dame is suggesting will be feasible.
I agree 100%. Makes sense.
Yeah, I have another question here. This is from, I believe, Sarah Bond. She asks whether she says the lockdown approach shows a great respect for the individual because it shows concern for each person and not wanting anyone to die. And her family, they are sheltering at home because they're protecting their 86-year-old mother. Doesn't this show a Christian view of the dignity of the human person? She would like you guys to address the desire that fewer people die versus looking at human beings en masse. So probably, right, our conversation has more or less been abstract in terms of human beings. And Sarah is saying, look, what I'm doing here is trying to actually protect my mom, right? Thoughts on that? I mean, it's obviously the case, right, that they have a charity, a concern for their mother. Anyone, Mary or Paul? Yeah, Mary.
No, that's just the hardest thing ever, because we do love our vulnerable people. I have an older aunt and uncle who are the most important people in the world to me, and I want them to stay safe. And I don't know how to balance this out. So individuals certainly have concern for people immediately in their lives, and then we have a general concern for the older people who, or just anybody who would be seriously impacted by the virus. The trouble is, we're not seeing the unseen devastation that's happening, right? So as you protect your mother, which is right and good and charitable and loving, the unintended consequence of that might be that, the person who used to wash your dishes at the restaurant has been locked up without a job and has given up and has fallen into despair. There's just there's going to be other lives are going to be lost. We're just not seeing them in the New York Times listed out name by name. So it's just what makes it so difficult and hard. Yeah.
Yeah, it's so difficult. Anybody else?
Again, I think that Kirk has been good on pressing us not to see this in terms of either ors. That I think that there are ways to protect grandma, right? That maybe aren't perfect, but we make a good effort at doing that in ways that don't have the devastating effect on the economy that we've seen by the total lockdown solution that we've chosen as our main tool in fighting the epidemic.
Yeah, and it, relatedly, perhaps another unseen effect, and maybe Sarah's even experienced this. I know we've experienced it in my own family. Is there's so much uncertainty about how to live and proceed that within families you can get arguments about exactly how, or should we be protecting mom or our aunts or whatever. So I'm sure there are other people who are experiencing real tensions or worse, in their homes over you're too cavalier about the disease, or you're too rigorous and so on. It's just so utterly complicated. Now, to that point, another questioner asks us a very strong question. This is from Ben Peterson, I believe, and it's from Mary and Dan. More or less, does Catholic social teaching have anything to say except, wow, that's tough? Like I just said. Right, we could all say, hey, common good, we should think in terms of the common good and subsidiarity and solidarity. Then we all kind of come down on, well, geez, it's kind of hard, right? Can't help you. Or do we actually have things that are helpful? Are these principles helpful in some way? And that was directed at Dan and Mary. So Dan, why don't you give it a shot?
Yeah, well, I think it does in many kinds of ways. I mean, the first, when you think about what I was talking before about the conceptions of the common good, right, and the ways in which those compete with each other, and the way that we even frame the questions. So one issue that I've been grappling with, fortunately, it's become abstract because the first wave passed and we didn't have to ration, is how to ration ventilators, right? And there are ways in which Catholic social teaching would reach out to the marginalized and the vulnerable and say that they're not to be immediately excluded for the sake of a utilitarian common good, which is simply an adequate compilation of the mean good of all the lives. So people who are thinking about rationing ventilators by saving the most life years rather than the most lives, which automatically becomes a way, I think, of discriminating against the elderly and the disabled. And so I think we would reach out to them and say they are part of us, and their flourishing is part of our flourishing. But it would also teach us to do so in a way that, again, when we think about the policy implications economically, would lead us to think also about our solidarity with the recent immigrant who's washing dishes in the restaurants that we're not going to anymore, and to be inclusive enough in our approach to say that their interests are part of my interests as well, and not again simply put all our eggs in the basket of grandma or in the economy, but try to find a way in which we're integrating both. And I think what you've seen is polarity, the kind of arguments you were talking about, and families are, who will wear a mask and who won't, right? And it's a political statement. We need to find, again, a middle ground, which would be, I think, more the sort of Catholic integrated understanding. I'd be interested to hear what you have to say.
Me?
Yeah, they were addressing it to you as well. So
okay, yeah, just the way the screen works, it was hard to tell. So yeah, I think Catholic social thought gives us principles that we can all identify about concern for the common good, principles of solidarity on the one hand, and subsidiarity. We've been invoking these over the course of the conversation. But the fact of the matter is the world is really complicated. And so a lot of it has to do with the individual's discernment about how do I respond to the immediate set of circumstances I have around? Like, in the situation, is it subsidiarity that's the more important principle, or is it solidarity? The discernment of the common good in general requires a prudential, an exercise in the wisdom of discerning what makes life worth living, and in light of those goods, how do I make these particular choices? So there's a little bit of a call for epistemic humility, that you can't turn to an expert even on Catholic social thought to say, here's the right answer. It says, here's some guidelines or frameworks, and then pray your way into it, or just, open your heart to what the situation calls for. And the other thing that the Catholic tradition offers that has gotten very little attention is just a reminder that this world is not the only one that there is. And the great thing about Catholic social thought is it reminds us that we care a lot about this world. But the reason I mention that is mortality rates are still 100% for everybody, no matter what. Every life will have death and suffering in it, no matter what. That's just part of the human condition. And I think part of what's happened in the modern world is we have some idea that we can get away from all of that and control it. And that's what leads to these horrible trade-offs and these horrible tensions. And I think if we could just bring it down a notch, saying, I love people and I want them to live and every life matters, and that's really, truly important. But I can't fix every suffering and I can't prevent every death. And just to have that judgment and just do it with a full heart of love, because we want to accompany people in this life as well as we can. But just also remember that at the end of the day, it's not our show. We don't get to fix everything.
Yeah, great stuff. Paul, and perhaps Kirk, you as well. We have a question here about economics. It's related, I think, to a little bit of a conversation we had earlier tonight. This is from my colleague, David Cloutier at Catholic University. He asks, will the crisis lead to the consolidation of economic power in larger and more distant businesses? And should Catholic social teaching have anything to say about this? Okay, so Paul and Kirk,
yes,
will it lead to that?
I think,
yes and yes.
Yeah, I think there will be a movement towards such consolidation, and certainly we should be talking about it from the perspective of yes. It won't be a complete consolidation, obviously, but small businesses are getting affected in ways that large businesses can avoid.
Yeah. No, I think that's an excellent point. I agree. And I think that, we've seen this movement. And I think one of the things that I think, listening to all of you, that I've learned from this is we in economics really have to respect heterogeneity in society, heterogeneity of households, heterogeneity of firms, heterogeneity of governments, different types of governments, and really take that very, very seriously. And I think this one size fits all, that there is some type of market, there's some type of, there's heterogeneity. And I think that's what we want to encourage and to stop this sort of increasing monopolization and concentration, especially in industry. I guess one of the things I also want to get back to it is that individuals who decide to go back to work or not, one of the things is, will we learn more in a few months? Who is more vulnerable or not? I mean, we all have pre-existing conditions. Is there a way doctors will be able to give information to individuals, heads of households, whether they are at higher risk or lower risk, say myself as a university professor, going back into a classroom, so we could tell our colleagues, maybe you should just do your course online. Other colleagues, you could have a regular course. I think the idea of respecting the heterogeneity of people, both in their health, but also the way they live and also how they conduct their business is going to be very, very important.
And there is a lot already known about predisposing conditions that make people vulnerable, and I think that's better known than lots of other things. So age, hypertension, diabetes, lung disease, heart failure, immunosuppression. So we can give that kind of advice, but the economists will agree that people can make reasonable choices in local situations. And I can tell you, within Georgetown, as much as I tried to volunteer, my colleagues said I'm over 60. They weren't putting me in the front lines in the hospital. I have seen patients in the outpatient setting, and it's been mostly the residents who've gone in and done the testing. So people have had local wisdom in terms of saying who's more vulnerable and who's not, and and help to sort of sort that out on the base. But they need the information. You're right, and we need to make sure that that's conveyed to people as we develop plans.
Great. We have a different sort of question here, but it's probably one that we all could have anticipated. It's about the voice of the church throughout this crisis. And the student, I believe he's a seminarian, perhaps his name is Toma Jelka, I hope I get it right, asks, essentially, why did the church globally and without restraint or question give in to this shutting down of things, including, of course, of masses and so on? Father Paul, perhaps maybe you could, sort of, take a shot at that. I guess first, of course, is whether we stipulate that, in fact, the question is correct, that the church just gave in to the diktat of the state, hey, shut down. Number one, do you think that that's an accurate portrayal of what happened? Yeah, please.
No, I mean, I think one of the things we know is that the Catholic Church has a long memory, and they've lived through crises and panics and plagues before, and so I think our Catholic leaders, from the Vatican, from local bishops, Cardinal Dolan is a church historian. I mean, I think they know what has happened in the past, and I think and so I think they've seen what the church had done in the past as well. So I think that it was a very reasoned response. And I think in terms of, and it certainly, I mean, they've done their very best to be available in various types of online, services for people. So I think that, I think they, I certainly respect our hierarchy and our, for responding with great compassion and care for their people. And I think, so I don't think, I really would disagree with that question, that perspective that they have been negligent in any way. But I think they have been caring pastors with a long memory.
Yeah. And I think also with a concern for the common good was one of the strong motives for complying with those things. Although I, like probably everybody else on the panel and most of the people, and can't wait to actually go back into a church with other people and maybe celebrate the Eucharist with other people live and not online again. I mean, it has been a real burden to not have the. I mean, we call it real presence for really good reasons.
Sure. That's good.
I guess I could have wished for a little stronger response, not in the sense of having masses. I understand exactly why they felt exactly for the common good as you talked about it. We had like a few priests, but not as many as I would like to see, who would like take the sacrament out in the monstrance and walk around the streets of Philadelphia with it to make it present to people. I know that happened in Italy and other places. Mm-hmm. I don't know how many priests really push hard to go ahead and risk their own health to accompany people in death and administer those final sacraments. I don't, and above all, I would really have liked more spiritual ministering to the sense of loss of the sacrament for the faithful who are asked to stay home, because communing online is not, it's not, we're Eucharistic people. We believe in the real presence. That's both of the sacrament, but also each other. I found it really painful when we got to Easter and the liturgy was all about, let's feast, and I'm home not feasting. And I could have appreciated a little bit more pastoral help with that. So. Yeah.
I would say, I think I'm in agreement with everybody, but I do agree with you, Mary, there. One thing I thought was missing, or I just, I'd see it occasionally, I wish I saw more, was the church articulating on her own terms what we were up to, right? In terms of, Mary, in a way of what you described before, the sense that, we're all destined to die anyway, but destined hopefully to be reborn. And that what we are suffering here is provisional, right? And here's how and why we can rationalize momentarily stopping. At times I felt it was, to the student's question, a little bit too much as though the church was receiving her orders from the state, okay, and now go do it. And she was faithful. I'm sorry, I'm letting my dog into the room. And now she was faithfully, responding reasonably to the state. But there was, I think, an opportunity here to articulate how we see this, and and then respond accordingly. Why don't we wrap up? I have one more question that I want to direct our attention to, and then perhaps I think we may have said enough, even though there's so much more, of course, to say, and there's always other things that are intruding. This is a forward-looking question, and I think it's a really good question for us to end on. It's from John Watkins, and he says, or asks, do you have any thoughts about simply going back to the system we've had versus building a different and perhaps better system? And we've touched at times on some of the issues that COVID itself has sort of exposed. They're there, but there's sort of inequalities in delivery of healthcare, inequalities in the kinds of conditions that predispose people to suffer more greatly, either economic or health conditions that predispose them to suffer more greatly as a consequence of illness and so on, right? So there are lots of issues we've discussed, but is there some hope that maybe this will allow us to, at the minimum, tinker with things and move forward in a better way? Do you guys have anything to say to John, the audience, on that question? Maybe the economists could wait. Kirk, you want to take a swipe at that first?
Well, I think we're always changing over time, and it's difficult to tell whether those changes are due to an event or would have happened anyway, even without it. So I'm certainly things will change in the future. If the question is leaning in the way that it's sometimes been phrased elsewhere recently, I think it might. I don't want to overinterpret it. It might be leaning in the direction of, can we move past a relatively free market capitalistic system to something more egalitarian, where that egalitarianism is attained not through redistribution ex post, but through some sort of ex ante communitarian ethos that's at the heart of our economic activity. Mm-hmm. I guess my answer would be I doubt it.
Thank you.
I wasn't sure what was meant by the system.
Yeah.
But in terms of changing,
Mary, watch out for the system.
My own work tends to not focus on the system. I don't think too much about questions about how much state or how much private stuff we should have. I think a lot about the culture. And this does seem to be like a big opportunity in the culture. We've already highlighted the strong impulse people had to make personal sacrifices to protect other people. There's a chance to build on that instinct of solidarity, I think, which is really profound. For those who have been sort of kind of chilling out at home with the Netflix and the family and stuff, I had a million events that got canceled because of this, and I'm not totally sorry that my life slowed down and I had a chance to. So, there's room where maybe we'll see that some of our priorities weren't where they should have been. There's always that hope for renewal. My fear is that we're going to think that online connections is a substitute for in-person connections, and I think that's just not right.
In terms of healthcare, I think if this teaches us better ways of caring for the elderly who have been disproportionately burdened by this, that would be a great outcome. If we can find better ways of serving the healthcare needs of minority inner city populations, which disproportionately have been affected by the virus because they are disproportionately affected by high blood pressure, diabetes, obesity, cigarette smoking, etc. If it teaches us to find better ways to improve the healthcare of the elderly and the poor before the next pandemic, that would be valuable. Maybe I'm more in Kirk's camp that I am skeptical it will happen, but we can hope that people will wake up to sort of see that the disproportional effects in the population were due to pre-existing disproportionate treatments of certain segments of the population.
Great. Father Paul, a final word?
Yeah, just one last thing. As I guess I was thinking about this at the end of World War II, reading our history, people were very pessimistic. They were expecting a big depression, and it didn't happen. I think people were willing to pay high taxes, hold government bonds, educating servicemen. So I think that maybe there will be a new patriotism and a new willingness for social cooperation. We could hope and pray for that, as we recover. And God is a God of surprises, and that did happen at the end of World War II. Obviously there was the neglect of civil rights in the 50s and other bad things, but there were some surprising actions. Inequality decreased. There was increasing labor share in the population, debt came down, there was steady economic growth. A lot of good things happened at that time when people were expecting, another depression.
Yeah, well, look, great. We ended on an optimistic note, and
Okay.
that was completely unorchestrated. I just want to say this was a total pleasure for me to get to know some of you guys, to get to know a couple of you better. This is really fantastic conversation, and obviously just a kind of beginning or maybe the intermediate stage of a conversation that I'm sure will continue. And I hope some of us or all of us are able to do this again. Thank you all for your time.
And
Thank
on
you.
behalf of
Pleasure to be with
the
all of you.
Yes, and on behalf of the Lumen Christi Institute, I do want to thank each of you, our panelists, and especially you, Joe, for moderating, doing a fantastic job moderating. It's really hard to hold these conversations in Zoom, and we appreciate each of you for the work that you've done to help expand this discussion, help us go a little deeper than sometimes our polarized climate allows. I want to thank each of our co-sponsors, but especially America Media, Credo, which is the Catholic Research Economist Discussion Organization that actually 3 of our panelists are members of here today, and the Institute of Human Ecology at Catholic University of America, led by Joe here. We appreciate each of you, our audience members, for tuning in. If you did enjoy tonight's conversation, please do share our programming with others. Not only will this video be up later on YouTube, but we have a great set of events coming up this week and into the future, into the summer. And if you want to support our work to help deepen our cultural conversation with the leaven of Catholic social thought, you can donate today at www.lumenchristi.org. Once again, thank you to each of you for a great conversation, and we look forward to ongoing conversations in the future. All the best.
Thank you, Michael.
Thank
Thank you, everybody. Goodbye, everybody.
Thank you very much. All right. Good night now.
Bye.